Hi guys. Oh my goodness, has it been a day? Actually, the last couple days. Apparently, I have a new diagnosis and I didn't even realize that I had it. They give me this little card that I'm supposed to present to, well, it tells me under what conditions I go to the emergency room. They give this to all chemo patients. But on it, it has my diagnosis. And I didn't realize that my diagnosis right now for this particular tumor is peritoneal carcinomatosis. And that's really unfortunate because it's not a great disease. Here, I'll just read to you what it is. That would be a lot easier than me fumbling around and trying to explain it. Okay, here it goes. So I'm going to read it from two separate places. Peritoneal cancer is a malignant tumor of the peritoneum, a thin layer of tissue that lines the abdomen. Peritoneal cancer develops from metastasis of other tumors. Peritoneal metastasis can originate from nearly any other tumor, but most commonly from gastric, intestinal, and ovarian cancers. So that's just a really quick explanation. But that wasn't exactly what concerns me. What concerns me is the outcomes data that regards this whole diagnosis. Now, you know, my oncologist is a great oncologist, and I didn't ask the question, which doesn't necessarily mean that he should not have given me the information, but I think he didn't because I'm anxious enough about this that it probably would have just freaked me out. Not that not that having me look it up is freaking me out any less. Sometimes being a clinician and having a disease like this is the worst possible thing that could happen because you look stuff up. Now, I always used to tell my patients, stop Googling stuff. You know, they would come into the emergency room and say, I have stomach pain and I think I have A, B, C, or D. And I would just go, in my head, you've got to be kidding me. Well, clinicians, particularly nurses, and I'm sure especially doctors, they do it too. Only we don't just do it. We go through everything. I mean, I go through Google Scholar, I look up and everything on NBCHI, everything. So anyway, this is what concerned me, okay? In the United States, approximately 20% of patients with colorectal cancer present with distant metastasis at diagnosis. Now, technically, mine is small bowel cancer that had metastasized pretty much everywhere. It had metastasized to, in case those of you who don't know, adenocarcinoma of the small bowel is what I was diagnosed with on March 17th or March 12th of 2017. It had metastasized to both of my ovaries, my uterus, my omentum, which is all the jelly-like stuff in your abdomen that surrounds your organs, my omentum, and 13 out of 17 lymph nodes. This is the part that if I start crying, I'm just going to stop, gather myself, and then come back, okay? This is my anxiety issue. Peritoneal carcinomatosis arising from colorectal cancer has generally been considered terminal, with a median life expectancy of 5.2 to 7 months after initiation of chemotherapy. 5.2 to 7 months after they initiate chemo. Well, here's what I have to say to that. Tough shit. I have no I have no intention on going anywhere. And so they're going to do radiation, and they're going to do a different type of chemotherapy. Actually, this chemotherapy is called Xeloda. It's spelled Xeloda. Haven't looked that up yet, thank God. Apparently it's supposed to be a little bit stronger. I take 3 pills in the morning and 3 pills at night. I start that when I start radiation, which I think is on Monday. I'll find out tomorrow. So basically they're going to radiate this tumor and start the different chemo in order to get it shrunk enough to get me a surgery. Now the surgery is extremely difficult surgery. This tumor, see if I can show you. This tumor is located like between here, and I can't show you. Okay, so anyway, the tumor is located between, I could probably show you, but it would be X-rated, between my tailbone and my rectum. There's a very tiny space in there called the peritoneal space, and that's where my tumor is. It's 4.1 centimeters, which is a little bit bigger than that space is, and that's what's causing all the pain. I mean, it kind of hurts to sit, it hurts to do a lot of things right now, but right now, you know, sitting, I just change positions a lot. I can't really find a comfortable spot laying down, really. And the kicker is that, like I had somebody tell me today, but Cindy, you don't look sick at all. You look perfectly healthy. Good, great. I mean, what am I supposed to say to that? I'm just say, well, thank you very much. I mean, to me, that's a compliment. Thank God I don't look terminally sick, but I don't, because I don't want to be. So, this is what I have to say about the 5.2 to 7 months. No, not me. I mean, they told me initially I was going to have 6 to 9 months to live with a 5% chance of making it 3 years, and it's been 17 months now. 17 months, 4 surgeries, and every other week chemo later, and here I am. However, I can tell you that I have more bad days than good right now, and when I say bad days, I just mean feeling wise, that physically feeling bad days. And it sucks. You know, pain makes you exhausted, and anxiety makes you exhausted. And you know, when you have something like this, like I've got anxiety all over the place, and they can give you medicine for it. The thing is that I take the anxiety medicine, and it knocks me out. I don't want to live the rest of my life sleeping because I have anxiety. What I used to do with anxiety is work out. I used to kickbox. I did. I ran. I lifted weights. I did everything. Sweat. I mean, for as long as it took to get my anxiety out. That was pretty much my anger management, and my anxiety management was exercise. And I can't do that right now. I can do a little bit of it, but not nearly enough to take care of this much anxiety. So I do take anxiety meds here and there, but I take about half of what they prescribe me so that I'm not knocked out, because I don't want to be sleeping the rest of my life. I want to live my life. And right now it's getting very difficult. You know, I've been working all day on a GoFundMe page. I'm usually a pretty good writer. I can usually write pretty well. And I have written and rewritten all day long because it's not natural for me to write that type of thing. But I will, and I'll get it done because I have to. I don't know how we're going to do this. My husband works, and I have to drive myself, and it's 200 miles a day, and I know at some point I'm just gonna think, God, I can't do this. So I have to figure something out. I mean, we have exhausted everything, but I'll talk about that a little bit later. I just wanted to let you guys know that if you're a cancer patient and if you're like me, you've gone through a little bit here and a little bit there, or you've gone through consistent management, and then all of a sudden there's a new thing, a new tumor and new management, ask more questions than what I have done. I have basically just said, yeah, okay, this is what we're doing, and understood the clinical aspect of it. Okay, well, this is what we're doing. But I haven't really asked, do I have a new diagnosis? Is this something different? Is it a different kind of cancer? What they're treating me for now, this peritoneal carcinomatosis. You could almost like make a song out of that. Peritoneal carcinomatosis. Anyway, it's not different than what my original cancer was. It's just it's a type of metastasis. This tumor comes from the originating cancer. It's just in a different spot, and unfortunately that spot, it's not a place I want it to be. But we don't always get what we want. Except this cancer doesn't know me very well, because I have a little bit more in me, especially now, because I'm having a really good day right now, so I've gotten a lot of things done, and that is when I make the decisions. And I have decided that this isn't going to happen to me the way that it's happening to me. I'm not going to be the statistic. I'm just not. Maybe I'll live 10 months just to piss it off. I don't know. Maybe I'll live the next 5 years. I hope so. But maybe I won't. And I have to prepare myself for that. And that's the other thing I want to just express to people, is that when you have good days, you feel like you're invincible. You feel like, sometimes you even feel like you're not sick. I mean, but I haven't felt that way for quite a while. But you are sick. And it's always in the back of your mind, and for me, I can't just let that go. It's always there. So even though I say I am not going to be dead in 1 year or in 10 months, I have to be realistic about it and say that there's probability that I will be. So I still have to maintain keeping my shit together, so to speak, and making sure that all of that's taken care of. And all of it gets stressful. It's overwhelming. It's expensive to have this disease. It takes a toll on marriages, on relationships with children. It takes a toll on your own mentality. But you know what? No, I'm not going to let this happen. Not the way that they say it's going to happen. I'm just not. I don't know how I'm going to beat it yet, or make my life last longer, or whatever. That's just the way it has to be. I think I keep repeating that because I'm trying to convince myself, or trying to convince you guys. But anyway, that's it for today. What I wanted to tell you again was thank you, thank you, thank you. Thank you, thank you. We have almost 80 subscribers. My goal is 1,000. I don't know. I got to do something crazy when we get 1,000 subscribers, if we do, but that's my goal. If we go over that, yay. If I don't meet that, it's okay. But your guys' support has been tremendous so far. It's only been a couple weeks, and already I get a little message from you guys, and I smile. And that's probably more smiles during the day than I've had for a long time. So thank you guys. You have helped me a whole lot, and hopefully I'm giving that back to you. So until we meet again, I will have a good night. Sammy's going to be home any minute, and we're going to have uncontrolled chaos, just like normal, which is great. You guys have a good night. Tomorrow is Meet the Radiation Oncologist Day, so I'm sure I'll be taping that. And we will talk to you soon. Bye!